The coronavirus crisis is changing the world. One thing has not changed. We are still fighting for gender equality. The crisis has amplified the existing structural gender inequalities. It has further exposed the fact that women are overrepresented in the essential services of our societies, especially in healthcare. Women represent 78% of workers in healthcare services in the EU. Working daily in these services exposes workers significantly to the virus and to its health effect. However, despite women's overall overrepresentation in the health and social care workforce, they remain underrepresented in senior leadership roles. 72% of executive heads in global health are men. Women tend to be more in the lower paid jobs. In other caring professions, including care for the elderly, for instance, where women represent around 90% of the workforce, there is the same pattern. The care professions are some of the most undervalued and underpaid jobs in the EU. The economic and social consequences of the pandemic are therefore likely to hit women harder in the long term as they are overrepresented in these sectors. There is also an intersectional aspect to this reality, as many of these women care workers are migrant women who are filling the gaps as nurses or long-term care workers where shortage prevails in wealthy EU countries. The EU's Gender Equality Strategy 2020-2025 pushes for progress in advancing gender equality in several areas. It is the EU's clear gender-sensitive response to the crisis and to preparing the EU for its recovery. The strategy sets a series of actions to promote women's socio-economic empowerment in a Europe where women can be free from violence and gender stereotyping. To deal with the gender disparities in health and care services, we must challenge gender stereotypes and bias. Gender stereotypes are at the root of all aspects of gender inequalities. The Commission will launch an EU-wide communication campaign on combating stereotyping with an intersectional approach and focus on youth engagement. Challenging the reality that women are overrepresented in lower-paid positions in the healthcare sector is also important for closing the gender pay gap. To really value the contribution of women's work in healthcare services, we must pay them fairly. On the 4th of March, I presented a proposal for an EU directive on pay transparency as a first step towards fair and equal pay for equal work between women and men. Equal sharing of care and domestic work should also be the norm. We will monitor the implementation of the EU's Work-Life Balance Directive so that men and women can enjoy the same opportunities at work. Let us use this moment of a changing world as an opportunity to build back stronger, inclusive and more equal societies where women's roles and the healthcare sector are valued and recognized fairly.